Hi, my name is Dr. Renata Velitis, and I'm an Evaluation and Research Manager at the Knowledge Development and Exchange Hub for Mental Health Promotion. I started this role back in September of 2020. I would have been working at an office at Renison University College at the University of Waterloo, but because of the pandemic, I started this position working from home. Although I didn't meet them in person, this was our team in 2021. Two of my colleagues, Annette and Eric, joined me in interviewing project teams that were working on the front lines of child and youth mental health promotion. These projects were part of the first phase of the Public Health Agency's Mental Health Promotion Innovation Fund. This 10-year investment contributes to mental health promotion that is evidence-informed, sensitive to contexts, sensitive to cultures, equitable, and sustainable. The first phase of this program included 20 projects that were working in locations all across Canada. We interviewed these projects to learn more about how they adapted their interventions in the context of the COVID-19 pandemic. This video shares just a few highlights from these conversations.
I have never seen anything like this in my life, in my career.
Yeah, our role is fluid. It changed so much, especially with the pandemic. It has been so many things at so many different times.
The pandemic is what it took for the government to really say, aha, we get it. Like we understand school mental health is not a nice to have or a add-on, it's an essential service.
Puis au Québec, c'est un gros tabou, mais la pandémie a permis vraiment de mettre le zoom sur la santé mentale.
Puis non seulement c'est que les mots sont maintenant à la mode, dans le sens qu'on les entend continuellement. Avez-vous pris soin de vous autres? Votre santé mentale va-tu bien? Consultez si ça ne va pas bien. C'est un message général dans la société. Donc, on est allé plus loin, probablement plus vite que si ça n'avait pas été la pandémie.
The clips that we are sharing are only a few highlights from some of the projects, but all 20 projects had to make significant changes to their plans as pandemic conditions evolved. Key to their efforts was meeting the needs of the populations that they serve, and even expanding who they serve as the need for mental health interventions became more and more evident.
One thing that I've really been surprised by, but also very flattered by, is that community organizations and community groups are now reaching out to us and saying, we want to have your organization come and do a workshops.
And we haven't done any advertising at all. It's just like, honestly, it's just been word of mouth. But it's really exciting, and it shows like how huge the need is.
Especially during the lockdown here in Manitoba and Winnipeg. It was during the winter. It was very cold, like -40 outside. We couldn't go anywhere. All malls were closed. So it was a very stressful situation for kids and families. And I felt like that this was the peak of the attendance. Clients were attending very regularly. And I think not only did that give them the knowledge about mental health, but it also gave them a community, a way to socialize, a way to connect to other kids. And this was like a little outlet for them.
The brokers are quite literally advocating at a policy level while doing frontline work day to day. It's really quite remarkable. And then there was also the vaccination crises. We really had to push to get our community vaccinated. We respond to the community's needs at the moment, and the community's needs are so great and so concerning so often. Our program ends up having to shift dramatically because of it.
A key focus of these conversations was how project teams had to adapt to virtual programming, but in changing their method of delivery, many project teams actually found some unexpected benefits, including increasing the reach of their program, and in some cases even scaling up a lot faster than they had originally expected.
It's forced us to look at the use of technology from an access perspective, right? So it isn't just about, oh, this will be more convenient. It's really realizing that, you know what, for people to come to Toronto from Temiskaming, it's not easy and it's expensive.
On ne pouvait pas se déplacer le matin en Gaspésie, l'après-midi au Saguenay, alors que le contexte de pandémie nous a forcé un peu à transiger vers l'accompagnement des écoles en ligne. Puis ça a facilité le déploiement plus large. Fait que ça, c'est peut-être un aspect plus positif là, que la pandémie a eu sur le déploiement à plus large échelle du projet, là.
You know, originally we were worried about the impacts on relationship. We were worried about engagement and Zoom fatigue when everybody has to be online all the time. And from the data, those worries seem misplaced.
The ways in which families organically became more involved in the program also stands out as a really big success.
Like I remember you talking about a group where a young woman did the entire group with like a 2 or 3 year old sibling on her lap because she was the caregiver, but she was able to be part of the group in a way that, again, our old model of, well, get your mom to drop you off from 6:30 to 8:30 every Wednesday would not have been accessible.
You know, the youth especially that are really struggling with kind of leaving their house, and we have a lot of highly social isolated youth anyway, due to, you know, the transphobic society that we live in. I think that it allows them to attend in some safer ways, right?
We formed that kind of bond with each other very quickly online. We were worried about that. We wondered whether we'd lose that part of the program, but they actually came to rely on each other and really look forward to the sessions.
That virtual space to meet in, even if the pandemic was over tomorrow, would still be very necessary. Yeah.
Project teams emphasize the value and importance of building relationships and trust, both between and among program facilitators, children, youth, parents, and communities. Projects shared with us how they built trust and safe spaces in online programming, and often highlighted the importance of the role of the facilitator, cultural sensitivity in programming, and also active engagement with youth. It was promising to hear about many of the project's successes and positive impacts of this very intentional relational work.
I think one of the key things is not being, not having your curriculum or your agenda stuck in stone. The more autonomy and the more choice the youth have in the topics and the discussion and what you're going to do, seems to be the greater the engagement levels too.
And watching the impact that the trust has on the youth that are joining the group and the youth that have been, experiencing this for a while, and people just being able to see that like you're actually getting to learn something that's relevant to you, and there's no box and there's no expected output, and watching the light bulbs go off and like their minds get blown by this concept that the people that are like the adults in the room, right, are actually just trusting them to be able to take control of their own learning. That's pretty incredible.
Another thing that we've noticed is just how incredibly beneficial like the peer support aspect has been for them, and like folks who are kind of, a lot of youth have actually come out during the pandemic and I think have felt like really isolated and a lot of fear around kind of going back like into the world kind of after this experience of like transitioning or coming out kind of in quarantine, and going through that with other people who get it is huge. Like, I mean, there's been a few instances where the word life-saving has been used, and I don't think that's an understatement. We've had youth who have come into the group and have shared that this is the first time that they're talking to another trans person, like they've never met another trans person before in their life, and all of a sudden they're surrounded by folks who really get it. And so I think not that we underestimated how like beautiful that would be and meaningful, but I think it's felt like a huge success. Yeah.
But there's a lot of systematic barriers that come in the way of participation and engagement in these parent services. And I think because of our existing diversity of our graduate students and staff, we were able to implement parent sessions in English, Arabic, and Spanish as well.
I mean, I can speak to the effects of systemic racism on health, But, I have a disadvantage and like, I'm not an expert at either. So, we could bring in people with expertise to speak to specific topics. And I would say that was one of the strengths is that, bringing in key guest voices to reinforce topics or bring up new topics that we wouldn't necessarily have had. It's never a bad idea for youth to see themselves reflected in the presenters.
We are working with populations across the North, having facilitators who are representing populations across the North has been super helpful, and not pan-indigenizing our retreats has been fantastic, so that we are getting different perspectives and everyone's voices are heard.
It's really a blessing to be able to work, at an organization where your voices are heard, where you're able to help your community with the right resources. And when you are able to achieve that kind of trust within the community, then you can do anything.
Despite challenges being faced by projects due to the pandemic, the positive impacts of these programs are being realized as learning and momentum continue to grow.
The fact that we are able to have this program from a population health approach is like, it was so timely, don't you think? It's so timely that we are able to provide this for anybody who's experiencing any level of difficult parenting or challenges that way, and or if they just want to hone their parenting skills and prevent issues from happening. Like for Canada, this is a huge step in the right direction for us from a mental health population prevention and promotion approach, because boy, we're seeing great results, right? So it works.
It has given IMP an opportunity to really highlight the inequity of access to services by Indigenous communities. So there's been some real system change. I think for me, in terms of IMP's advocacy role, the pandemic has really helped me see that if we don't speak for really young children and their families, literally no one will speak for them. No one. We're changing systems. Like, we're actually changing systems.
Oui, fait que là, ça vient démontrer, tu sais, que on est vraiment, tu sais, bien aligné avec ce volet-là également, puis qu'il tient la route dans le cadre de la COVID aussi, tu sais, il a su outiller les jeunes à mieux passer à travers.
We like this process and we don't like to this, project stop.
This has been such a wonderful conversation, and we really appreciate you taking the time and sharing everything with us. We have already learned so much from the projects of the Mental Health Promotion Innovation Fund, located across the country, working with children, youth, and their caregivers in a range of settings from diverse groups, all unique, but all working together to learn what works to improve the mental health of young Canadians. You can learn more about the Mental Health Promotion Innovation Fund and the 20 projects on the KDE Hub website, and you can learn more about what we learned from these conversations in the Mental Health Promotion in Action series that you'll find there. It's been an honor, both professionally and personally, to hear firsthand from the projects about their stories, their successes, and their positive impacts that they're having in the field of mental health promotion.